My name is David Bell, and I'm a consultant psychiatrist in psychotherapy at the Tavistock and Portman NHS Trust, where I'm being interviewed today in my room. All aspects of mental health are responsive to the kind of social context in which we live. So that means the immediate context, like your immediate relationships, it means your employment, it means the culture in which you live. And we live in a culture in which there are many, many ingredients that are very, very bad for your mental health and which cause people to be depressed. Number one, of course, is unemployment. Number two is lack of any secure employment, so going to move from job to job with no security. Number three, I would say, is the kind of rhetoric that's become part of our neoliberal culture. That is the fueling of contempt for people who are suffering. People who are suffering from mental illnesses, and people who are expressing their suffering through various forms of social alienation. I'm thinking of, for example, dividing the world into good people, strivers like us, as opposed to those skivers living on benefits. Now, it's well known that there's no really significant loss of national income from people cheating on benefits. It's relatively small and relatively economically insignificant. But this kind of culture creates a culture of hatred. And all of us working in mental health see patients every day with one of their main problems. The expression of their chronic depressed state is low self-esteem, feeling they don't belong in the world, feeling they're not entitled to anything. Well, you don't have to think very hard to think how they're affected by a culture that's constantly telling them they're skivers, they're not entitled to anything. All of us know people who don't go for their, it's now called pimp interviews, because they themselves don't believe they're entitled to benefits. They're so depressed. They've got such a low opinion of themselves. Others don't go for their interviews because they're terrified of them. They're terrified that someone's going to tell them they're a worthless human being, or they're going to have to justify why they can't work. And that's a kind of brutalisation of the mentally ill that makes them depressed. And in my view, anyone with serious mental difficulties, all those administrative matters about their benefits should be handled by the professionals dealing with them, who can give the best information that's necessary, and not force people to face these panels, which contain people who have often no experience of mental health. We all know there's been this tremendous acceleration in inequality and tremendous concentration of wealth in a very small sector of the population. And this has consequences, because the cuts, which is part of the neoliberal project, the cuts in social care, the cuts in psychiatry, the cuts in the provision of services, the closure of services, the cuts in the level of skill available as resource for people suffering from mental health difficulties, all these have been savagely cut. So there's a huge pressure to focus on short-term, so-called evidence-based treatments, which such as 6 sessions of counselling, or a computer program, or reading a book. And the problem is that those kinds of provision, which go nowhere near getting to the humanity, the human relationship with a person and understanding them, can be measured, and they're cheap. So they provide a whole industry of measurement and cheap treatments that actually many patients we see feel terribly shortchanged by.